If you're about to turn 65, you need to know what you're going to say yes to in Medicare and what you're going to say no to, what you're going to delay, and what you need to enroll in. But to do all that, you need to know the basics of Medicare. So this video will do just that. We're going over the basics: Part A, Part B, Part C, and Part D of Medicare. When you know these parts, you'll know what to do with your own healthcare. Let's get into it. This video is going to be a quick, hopefully 10-minute video of the parts of Medicare. But if you're looking for a more in-depth, detailed, almost like a webinar, there's actually one in the description below. It's on demand. All you need to do is register for it, and it gets immediately emailed to you. So let's go over traditional Medicare. Traditional Medicare is going to be affectionately known as Part A and Part B of Medicare. Part A is going to be your inpatient, think your room and board when you go to the hospital. You'll need an overnight kind of plan. So Part A is your hospital coverage, and it's actually premium free. It's premium free for most people because most of us have worked more than 10 years in their life. So you got to have 40 quarters in order to qualify for Part A and in order for it to be premium free. Here's what it doesn't cover, though. Yes, it does cover a hospital, but it does not cover long-term care, nursing home, almost custodial care, maybe. It doesn't cover any of those. The deductible that you would need to hit is $1,632 at the time of filming this, which we are in 2024. In 2025, the numbers are going to change, but it is $1,632 per 60-day stay. And if you want an in-depth breakdown of Part A, you can go to, I think, 2 videos before this. I will link it in the description. It's not a good. So some people are thinking, all right, the 1,600, that's not a bad deductible. No. It's per stay. And then after that, you move to a per day cost share. So it's not very good. So if you are wanting to have original Medicare, make sure to add your Medicare supplement. Okay, so let's go on to Part B. Part B is going to be your medical, kind of like your in and out coverage that you currently do, doctor visits, those fees, diagnostic tests, labs, ambulance, an emergency room. If you're the in and out, kind of like urgent care, you got stitches, you go in, you get your stitches, you come out, that kind of care. Also, any durable medical equipment or non-self-administered drugs. So these are going to be those infusions. I know in a lot of rheumatoid arthritis cases are they have an infusion done, or even more obvious, the chemo that's done in a facility. That will fall under Part B. For Part B, there's actually a premium. I know a lot of you think, hey, I've been paying Medicare my entire life. Why do I have a premium? Because I don't make the rules. That's why. Okay, so it is $174.70 in 2024. It may be higher, though. This $174.70 is going to be your base. It may be higher if you are a high income earner. You'll get a income related monthly adjustment amount. And I've made a lot of videos about that as well, but it's got thresholds and you get a little cherry on top of the 174.70 if you fall within that threshold, that income threshold. So the deductible on your Part B is $240 annually. Not bad. Deductible, after the deductible is hit, then you have 20% coinsurance with no cap. So just like I said with Part A, Part B, yes, it's a part of traditional original Medicare. So if you're one of those that says, hey, I want original Medicare only, well, make sure you get a Medicare supplement, because the Medicare supplement will help you with that 20% coinsurance. Not only help you, but in the cases of a catastrophic event, you won't go into catastrophic bills. You need a Medicare supplement with original Medicare. I do not recommend original Medicare alone. So get a Medicare supplement to cover or to get yourself a cap. Now, to enroll, let's move on to the enrolling part. You will enroll in Part A and Part B of Medicare at ssa.gov. The fastest way to do that is to go through ssa.gov. Now, if you're still working and you're one of those that's like, Alyssa, I've got group coverage, I've got my group health plan, and I'd like to delay Medicare. How do I do that without getting a lifelong permanent penalty? Cue all the scary music. uh, if your coverage is credible, then you can delay Medicare. As long as it makes sense to delay Medicare, feel free to delay Medicare. Now, how to know if your coverage is credible? If your employer employs at least 20 employees or more, then you have credible coverage. And in that case, you can apply for Part A only. If, if you do not contribute to an HSA. So if you have a high deductible health plan and you contribute to an HSA account, a health savings account, do not enroll in Part A. It's a big tax no. Now, afterwards, let's just fast forward, and now you're 68, you're 69. You're like, Alyssa, I'm tired of working. It's time for me to retire. What do I do now? Well, you've got 8 months to enroll in Part B, as in boy, to avoid a penalty. You've got 63 days to enroll in a drug plan to avoid a penalty for Part D. So there's two penalties you got to worry about: Part B and Part D. Now, on to Part C. Part C is optional. It is an alternative to original Medicare. So this means you are picking United Healthcare, Cigna, Aetna, um, Devoted, Humana. You're picking those companies to supply you Medicare like benefits. So you're saying, Humana, give me some hospital coverage, some medical coverage, and it will come to you in the form of an HMO or a PPO, kind of like what you're currently on. Let's not make this complicated. Medicare at Part C, a Medicare Advantage plan, is managed care. You are currently on managed care. I don't want to say it's the same thing, but it's like 89% the same thing. You know what it is. So a lot of people call me, they say, well, what's the difference? What's the difference? Well, one is managed care. Medicare Advantage Part C is managed care. Original Medicare is not managed. So with the HMO and PPO, you're going to have networks. You're going to have to play by the rules. However, most of the times, it doesn't cost you anything to enroll in it. And oh, by the way, it includes dental, vision, hearing, some over the counter credits. So you're going to have to weigh your options. Do you have more money to say, no, I don't want to network. I want to call my own shots. I don't want to play by the rules and pay a monthly premium like with a Medicare supplement? Or are you at a point where like, look, I'm on a fixed income. I can do a little bit of wiggle room. I can wait a little bit for a referral because I see the value of a $0 plan because it gives me A, B, C, D. Not, I shouldn't say A, B, C, D. It gives me dental, vision, hearing, and the other benefits. Now, these plans will cover the same. It covers the same thing as what original Medicare covers because by law, these Medicare Advantage plans cannot cover more or less than Medicare. Now, there are claim denials. You make a claim with an insurance company, they can deny it based on whatever that is. I'm not going to get into specifics because you guys that are watching may have run into a claim once or twice in your life and there would be kind of some kind of pushback. Those things happen in uh, in the Medicare world on Medicare Advantage plans as well. So again, you got to play by the rules. They call the shots. They call the copay, the cost sharing shots. They tell you, hey, if you go to the hospital, we'll cover this much, you cover that much. It's a mutual agreement. If you do not want things to be mutual If you want to call your own shots and have more freedom, go with a Medicare supplement. Okay. Or at the very least, go with a PPO Medicare Advantage plan. Okay. Now, this actually rolls right into what I was going to talk about next, which is Part D, as in dog, as in drugs. Medicare Part C, it most of the times includes your hospital, your medical, your dental, your vision, your hearing, as well as your drug plan. So then you're like, well, what do I get in Part D? Well, Part D can be a standalone plan if you go with Original Medicare as your primary, Medicare Supplement as your secondary. And because Original Medicare does not cover prescription drugs that you go to the pharmacy and fill and go back home, they only cover the drugs that are administered at a facility. You need a standalone drug plan. So I want you to think of Good RX. You go to the pharmacy, say, "Hey, I got this coupon code here. Here it is." And then they discount it. That's what a drug plan is. You pay a monthly premium in order to be privy to these discounts. And you go to the pharmacy, you pull out your drug plan and you get your medications for the month or 3 months, whatever you uh, decide to fill. So it's offered by private insurance companies. Yes, it's a part. And just think the parts A, B, C, and D are very government regulated. The parts the parts of Medicare are laid out by SSA, CMS, and they're government issued. The plans are the Medicare supplement plans, which are individual private plans that you choose to back up Original Medicare. Okay, so back to the part D, those drug plans, they will cover the most common things. A lot of people maybe are a little fearful that it's not going to cover their drug. Most of the drugs that most people take, they fall under tier 1 or tier 2 drugs. What are tiers? Tiers are basically, if you think about it, here's a list, here's a list, here's a list, and here's a list. There's like 5 lists, and each medication falls under a certain list. The lower the list, tier 1 and 2, the cheaper the drug. The higher the list, 3, 4, 5, and sometimes 6, then those are going to be the ones with the higher copays. When you're searching for a drug plan, you want to make sure that your drugs fall on the lower list. That will result in a lower drug copay. Now, there's a lot of changes coming up in 2025. Please stay tuned to the channel. I wanted to make this really short and sweet so you can listen to it literally like on your way to work, maybe after lunch, maybe while you're walking the dog. So hopefully this satisfied hey, what are the basics of Medicare and what do I need to know? Because this was it in a nutshell. Stay tuned for 2025 updates. At the time of filming this, it's 2024. So a lot of the numbers I just spit out are 2024 numbers. We're in the month of August. So stay tuned for 2025 numbers. They're soon to come out. And I'll see you in the next video.